I'd like to introduce Viv from Scotland, who takes LDN for Hashimoto's thyroiditis. Thank you for joining me, Viv.
Hello.
Could you tell me when you first started to notice that there was something wrong with you?
Yes, in November 2012, it started off with a really, really strange symptom actually. I had a rash on my wrists, and I thought I've either eaten something that disagrees with me, or the manufacturer of my soap powders changed their formula. Took a couple of antihistamines, it kind of went away and thought nothing more of it. And then a week later, the rash returned with a vengeance, really, really severe, all over my body. And my face started to swell up as well. My lips blew up to probably 4 or 5 times their normal size. So, understandably, I was admitted to hospital, and they suspected it was probably at that point a food allergy. What food it was, they couldn't quite pinpoint. So that happened 3 times I was in hospital. And the answer really was, we don't really know what the problem is. We might send you for allergy testing, but in the meantime, here's some antihistamines. So after 3 or 4 months, my father had just been diagnosed with an underactive thyroid, and my mother also has a history of thyroid problems, albeit she's okay now. So I practically begged the doctor to test me for underactive thyroid, because I had been doing my own research, and there was a definite link between these rashes and the swelling, and in some cases autoimmune thyroiditis. I have to say the doctor I was dealing with at the time was quite reluctant, but I pestered them so much they gave in. And sure enough, my blood results came back with really quite severe underactive thyroid.
Right. Okay. So how old were you then, Viv?
37.
And you'd not had anything wrong with you prior to that?
Nope, I was probably what you would call the picture of health. Occasional cold, maybe a sore throat over winter, but I hadn't ever had cause to go to hospital or the doctor with anything serious at all.
So once you'd been diagnosed, what did they do for you?
Initially, not a lot. It was, I was getting a lot of antihistamines, and I kept having flare-ups of the rashes despite taking massive doses of antihistamine. I mean, the amount of antihistamine I was taking was, if you go into the chemist now and buy an over-the-counter antihistamine, I was taking the equivalent of 100 of those tablets every day.
Wow.
Just to get through a day. And despite that, the rash and the swelling would sometimes flare up. So this went on until April 2013. And I was getting a dose of steroids when this happened, and the flare would calm down, and then a few weeks later it would flare up and I would get more steroids, and so the cycle continued. And around about April time, I'd gone to the doctor again because I'd had another flare, and rather than seeing one of the practice doctors, it was the main doctor at the practice that I saw. And instead of just looking at the rash and saying, no, it's a flare, here's some steroids, he asked me a lot of questions. Not about the rash, but how I'd been feeling, the history of the illness, my previous history. And he came to the conclusion that it was probably some kind of autoimmune disease or dysfunction that was causing this. His theory was that the Hashimoto's thyroiditis wasn't actually the cause, it was a symptom. And he was pretty convinced that my immune system was completely overactive, and this was my body starting to actually attack itself. So at that point, he then suggested that I go away and learn about LDN, research it, come back with some questions. So that was when I'd gone onto the internet. He'd suggested a number of websites to me. I'd read lots of websites, lots of forums, from here, from America, you name it. And I went back to the doctor with the conclusion that actually the worst that could probably happen to me was nothing, as in it wouldn't work and I would carry on as normal. So that was the point where I agreed to try LDN.
Right. And who prescribed it for you? Did you manage to get your doctor to prescribe it?
Yes, initially I got my doctor to prescribe it, although now I do have to pay for a private prescription. He's not able to prescribe it to me anymore.
Okay. So, when you first started, did you notice any introductory side effects?
None whatsoever. It was a non-event. I'd read about people having vivid dreams and insomnia and sleeplessness. I was quite looking forward to the vivid dreams, but absolutely nothing happened to me. I had no side effects whatsoever.
Okay, and how long did it take before you started to notice any positive improvements?
I actually thought I felt better after a couple of days. Now, whether that was just my imagination or not, I don't know. I definitely felt like I perked up. We started my dose really, really low. I think we started at like 1 milligram and then raised it by halves at a time. So it was probably 2 or 3 months after I started taking it and I'd increased my dose quite a bit where actually I started to feel a definite difference. But not only that, people were commenting that they could see a difference in me.
So where are you at today, your Hashimoto's?
Okay, well, I currently take 3 milligrams of LDN. Just to give you a bit of background on the severity of my Hashimoto's, to diagnose Hashimoto's, if anyone's not familiar with it, it's a blood test for antibodies that they do. So a normal range, so somebody who doesn't have Hashimoto's will score round about a 6 on the antibody scale. Once you get further up the scale, if you get to 34 or higher, you tend to be classed as having Hashimoto's. Now, I can't tell you what my number is because the scale only goes to 1,000 and my reading is greater than 1,000. So it might be 1,001 or it could be 10 million. But despite having that severity of Hashimoto's, I only take 75 micrograms of thyroxine a day, which is absolutely, it's minimal, it's barely above the starting dose. And I know other people who have thyroiditis who don't have quite as severe a case as me, and they're on 2 or 3 times the dose of thyroxine. And thyroxine, whilst it's very necessary and helps you, it can cause long-term problems. It's been linked to, what's the name of the disease where where your bones thin? Is it osteoporosis? So it's been linked to that. So it's important to try and keep the dose as low as possible. And prior to LDN, my dose was increasing, and my readings weren't getting any better. But the second I started taking LDN, I haven't increased my thyroxine since then.
Wow, that's amazing, isn't it?
It's quite an incredible drug. I have to say, if anybody wanted to take it from me, they would need to pry it from my cold, dead hands.
Ditto. So what did your doctor say? I mean, did your blood tests improve?
My antibody tests haven't improved yet, albeit we're now working on a number of other areas to try and heal. Basically what we were trying to do initially was just get me feeling like a human being who could get out of bed again and stop the damage from getting any worse. And we are there now because my thyroid levels are very, very stable. And my dosage of my thyroxine's been stable for probably the best part of a year now. But we're now looking into other areas like diet and different things, vitamin supplements, to try and actually reduce the antibody levels and heal the damage that's being done.
Well, that sounds good. So, what would your advice be to other people that are newly diagnosed with Hashimoto's?
Talk to your doctor about taking LDN. Go and research it yourself. Learn about it. If your doctor won't help you, find another doctor who will, and keep going until you find a doctor who will. This drug is nothing short of a miracle. And honestly, I wouldn't be able to function as a normal human being like I do today without it.